Hello, Colin Hung here for Healthcare IT Today. And I am here in Las Vegas, Nevada for the annual health conference. And while I was here, I had the chance to sit down with Andrea Kowalski from 1upHeatlh. I wanted to ask her a question that I get asked a lot, and that is whether or not, as a healthcare startup, whether they should go all in on FHIR. What I hear a lot is, Colin, shouldn't I just adopt FHIR as my data standard? And if I do, won't I have instant access to all the data in healthcare? You can guess my answer. But I wanted to check with an expert who lives and breathes this stuff in interoperability. That's why I was really anxious to sit down with Andrea. Let's get to it. Andrea, welcome to the program.
Thank you for having me. Great to see you, Colin.
I'm excited to sit down and talk to you a little bit about HL7 and FHIR and all things interoperability.
Yeah.
But before we get there, for the benefit of our audience, can you tell us a little bit about you, your background, and your company?
Sure. So Andrea Kowalski, I'm Chief Product Officer of a company called 1upHeatlh. I've been in the healthcare tech space for about 15 years now. Spent a lot of my time actually more on the provider EMR side of things, really trying to help at the point of care. And one thing I've noticed through my career is that really what it comes down to is if we don't fix data, then we're all building on top of a shaky foundation. And so there's so much power to interoperability. So it brought me to 1UP. We are a API-based FHIR native modern data platform, and we're really in the business of helping data exchange within the healthcare system. So throughout really creating this ecosystem of data sharing to empower patients, empower providers, and really enable payers as well to make the best decisions for care delivery and be really efficient with regards to healthcare delivery.
I'm just going to get straight into the question I want to ask you, because I get asked this a lot. If I was a startup today, a lot of startups seem to be under the impression that, hey, they should go FHIR right out of the gate because instantaneously they'll be able to connect with everything. And then I kind of have to temper their expectations a little bit to go, well, you can connect with a lot, but it's still not super widely adopted. So if you were advising a startup, would you recommend that they go FHIR and go all in, or do they need to kind of diversify a little bit?
Well, I wish it was as easy as just pressing a magic button. But what I will say is I would definitely advocate that they go in on FHIR, but also recognizing that the state of healthcare data and just our large ecosystem is that there is data in all kinds of formats. But FHIR really is this future. And this is where, especially for startups, FHIR is really built in a way to actually support these startups and support more of that innovation. So I do think investing in FHIR, but knowing that you also need to be able to connect and bring the entire industry along as we kind of move towards more of that standardization.
So do FHIR, but don't be exclusive to FHIR.
Yes, yeah, exactly, yeah.
So, I mean, is there a day that you foresee that we will get to a point where if you just went FHIR, you're going to be fine?
I don't know what that day is, but I certainly hope that we will get to that. And the piece that I kind of really get excited about is the innovation. What we want to be able to see is more of these digital startups being able to focus on whatever they're wanting to focus on. They don't need to worry about all of the kind of complexity of interoperability and the data. So being able to use, say, a company like 1UP and our modern data platform allows them to actually be able to focus on whatever point they're trying to really kind of hone in and the problem they're trying to address, and really let us do all the complexity around interoperability. But it drives true innovation, which is exciting.
I think that's really key, because I think a lot of startups, they try to do everything themselves, and they'll try to build those connections with the specific systems, maybe not realizing that there are platforms like yours and others out there that can just do these. I've already built those connections.
Yeah.
So just leverage that. I know there's a cost obviously associated with that, but you'll be farther ahead because, as you said, they can focus on the innovation as opposed to the plumbing.
Yes,
right?
yeah,
Which
exactly.
is far more complex when you start getting into taxonomies and getting into data formats, and it's a miasma.
Yeah, as much as we think about it as a standard, there's still this complexity to the data and still a lot to kind of sort through. So that's my advice for any startup. And I've seen very successful ones through some of our customers that really have been able to focus more on, say, the patient experience, patient empowerment, and we get to handle all the pipes in the background so that they're able to get that data very easily, and they're able to really focus on delivering a world-class user experience.
So tell me a little bit more. How does 1upHeatlh work? How does your APIs work?
Yeah, so our modern data platform, healthcare data lakehouse, we are really focusing on helping our customers acquire data, really bring that data in, standardize that data, ensuring it for data quality, because that's a piece we don't really talk too much about, but if we're going to continue to move towards a standardization, we still need that layer of data quality and observability so we know that we can trust that data. So we bring that data together. We're really looking to enrich it, so combining claims and clinical data to really create kind of more of that longitudinal patient record. And then through our APIs, making that data accessible for various players within the healthcare space. And with that, a lot of data governance around who are you sharing data with and for what purposes? So especially as we look at payers, providers, and patients, really facilitating this kind of, this seamless data exchange. And what we're doing with that as well is really trying to adhere to to the CMS 0057 guidelines, which again is a great deal of work, but I think a really good catalyst in the market for us to drive towards that interoperability.
And who is your ideal client for the work that you're doing?
Well, as a chief product officer, my ideal client is everybody, right? Like I want to sell to everybody. So right now, we're primarily focused on the payer side for really the full interoperability suite. However, we do have plans to help facilitate data sharing between payers and providers, as well as really supporting the patient and having access to their data. And that's really through some of our great customers that are more of the digital health apps.
Well, Andrea, you shared a lot of great information with us today. Where can people go to find more information about 1upHeatlh?
1upHeatlh, 1up.health, it's there.
Awesome.
Yeah.
Well, thank you for being on the program today. Really appreciate it.
Thank you for having me.
I want to thank Andrea for coming on camera with me and spending some time educating me on FHIR and the latest in interoperability. I think it's fair to say that, yes, although we would dearly love, that everything is FHIR enabled, it is not. We definitely need to be handling multiple data formats in healthcare. I also appreciated her advice to startups to say, don't try to do this alone. There are plenty of platforms out there like 1upHeatlh and others that have already done the hard work of integrating and getting data to flow between systems. Don't try to do it yourself. Leverage one of these platforms. And hey, if you enjoyed this interview, please like and subscribe. Also, head on over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung here in Las Vegas, Nevada. Thanks for being here, and I'll catch you on the next video.